Welcome back viewers on Health Matters. I हूं अपने सवालों का सिलसिला से जारी करिए with Dr. Suri. Yes, Dr. Suri. Dr. Suri, आप ये बताएं कि what is the consequences of heart disease as in Journal and Pacific?
Smoking is a very common driver for high blood pressure, heart attacks, cholesterol buildup, stroke. A risks again on top of all the risk of cancer associated with smoking. The mere remarks I can find on dil matters. Heart matters as it relates to the heart. Rather, health matters as it relates to the heart. And consequences of smoking are tremendous. From a public health point of view, this would be the one thing that you could do without even going to a doctor, is to quit smoking. The other thing to recognize is smoking in combination with diabetes, smoking in combination with obesity, smoking in combination with congestive heart failure kills people. This is the simple message that I can give you.
Doctor साहब, जे person who pacemaker लग गया तो smoking कर रहा है या alcohol कर रहा है, drinking alcohol, does that affect the pacemaker itself or the patient with it?
It is more of an effect on the patient.
Okay.
The effect on the patient, who gets a pacemaker, who gets a defibrillator. ये जिहड़े मरीज हैगे इन्हां नूं पहले ही intrinsic heart disease है, उहदे वास्ते इन्हां नूं pacemaker या defibrillator दी ज़रूरत है. ते ये मरीज अगर अपनी natural body नूं ना respect करे ते फिर progression of heart disease is common. ते अगर किसी दा इलाज हो जाए by a cardiologist, patient the responsibility is to prevent the progression of the underlying disease. A simple way to prevent progression is to give up smoking.
Dr. Saab, we'll be very thankful ਜੇ ਤੁਸੀਂ ਸਾਡੇ viewers ਨੂੰ message ਦੇਣਾ ਚਾਹੋ ਜਿਹੜੇ ਜਿਨ੍ਹਾਂ ਨੂੰ heart problem ਹੈ ਤੇ ਉਹ pacemaker ਨਹੀਂ ਲਵਾਉਣਾ ਚਾਹ ਰਹੇ. This would be a very nice time to give them awareness for that.
My main message to patients is it is best not to need a doctor. And the way to do that is to not develop heart disease in the first place. You may not be blessed with the best DNA because you come from a stock. For example, the Indian subcontinent has very poor DNA when it relates to heart disease because the genetics are not so good. But that doesn't mean the situation is hopeless. There are many things in the hands of our patients, such as eating right, exercising, not smoking, decreasing mental stress, treating your high blood pressure, making sure that if you have congestive heart failure, you're on the right medication, making sure if you have a family history of weak heart muscle or blackout spells that you seek medical attention. To wait for the problem of blackout spells or sudden death to happen to you is oftentimes too late.
Dr. Saab, thank you for sharing a little motivational words with our viewers. Dr. Saab, as being a cardiologist, ਤੁਹਾਡੇ ਕੋਲ ਜ਼ਿਆਦਾਤਰ ਕਿਹੜੀ community ਦੇ patients ਆਉਂਦੇ ਨੇ?
Saadi practice is the United Nations of Cardiology. We have patients from all over, from the Upper East Side, from Queens, Brooklyn, Westchester, Northern New Jersey. They come from all continents. And we have our share of patients from the Indian subcontinent as well.
Dr. Saab, ਜਿਹੜੀ pacemaker ਦੀ heart ਦੀ problem ਹੁੰਦੀ ਹੈ, ਉਹ ਜ਼ਿਆਦਾਤਰ men's 'ਚ ਹੁੰਦੀ ਹੈ ਕਿ women's 'ਚ ਹੁੰਦੀ ਹੈ?
A common misconception है that women are spared from heart disease. But more women die from heart disease than, say, breast cancer. Last 20 years is awareness aa rahi hai that not only men but women are also almost equally susceptible to heart disease. The dil di takleef in women 5-10 years later does it present, but they live longer, so they are also equally afflicted in terms of numbers.
Dr. Saab, ਜਿਹੜੇ premature babies ਹੁੰਦੇ ਨੇ, later future 'ਚ ਜਾ ਕੇ do they actually build a heart problem? Or yeah, or वक्त दे नाल ठीक हो जाती है. Is there anything that our viewers need to worry about it?
The prematurity in all congenital heart disease is not uncommon
जी
because heart does not form properly.
जी
But ਉਹ ਜਿਹੜਾ congenital heart disease the problem ਹੈਗਾ is a very narrow area from a public health point of view. Most of the problem with heart disease in adults is not from premature. Most of it is from overnutrition, too much food, lack of
जी
exercise, insulin resistance, obesity, tobacco,
जी
and most importantly, again, और ਜਿਹੜਾ ਤੁਹਾਡਾ ਦਿਲ ਦਾ connection ਹੈ
जी
between the brain and the heart, too much stress in our lives.
जी डॉक्टर साहब ਜਿਹੜੇ ਲੋਕ ਕਹਿੰਦੇ ਨੇ ਕਿ ਸਾਡੇ ਦਿਲ 'ਚ ਸੁਰਾਖ ਸੀ ਜਾਂ ਕਿਸੇ ਦੇ ਦਿਲ 'ਚ ਸੁਰਾਖ ਸੀ is it referred to as a heart murmur or ਸੁਰਾਖ ਫਰਕ ਹੈ ਤੇ heart murmur ਫਰਕ ਸ਼ਾ ਹੈ
ਇਹ ਹੈਗਾ communication between one chamber and another chamber of the heart. ਤੇ ਜਿਹੜਾ heart ਦਾ structure baby ਚ ਹੁੰਦਾ ਹੈ
ਜੀ
when baby is in mother's womb
ਜੀ
is different than the structure in later life. Prematurity
जी
and for other reasons,
जी
sometimes you are left with a communication, ਜਿਹਨੂੰ ਕਹਿੰਦੇ ਹਨ atrial septal defect, ventricular septal
जी
defect, PDA. ਇਹ ਜਿਹੜੇ problems ਹੈਗੇ ਇਹ are best managed by a congenital heart disease specialist, and ਇਹ ਜਿਹੜੇ ਹੈਗੇ
जी
specialists in are normally pediatricians, pediatric cardiologists.
जी डॉक्टर साहब दिल ਦੇ 'ਚ ਸੁਰਾਖ ਜਾਂ valve ਸਹੀ ਤਰ੍ਹਾਂ ਜਦੋਂ ਨਹੀਂ ਬੰਦ ਹੁੰਦੀ ਹੈ does that has anything to do with atrial fibrillation or with the pacemaker later on
ਇਹ ਜਿਹੜੇ congenital heart problems ਹੈਗੇ ਇਹਨਾਂ 'ਚ very high incidence of atrial fibrillation. ਤੇ leaking heart valves, ਜੇ heart valves ਜੇ normally ਨਹੀਂ function ਕਰਦੇ, ਜਿਸ ਤਰ੍ਹਾਂ mitral valve ਦਾ problem ਹੋਵੇ,
ਜੀ
mitral valve leak ਕਰਦਾ ਹੈ,
ਜੀ
ਜਾਂ aortic stenosis, aortic valve properly ਨਹੀਂ open ਕਰਦਾ,
ਜੀ
ਇਹਦੇ association of valvular heart disease and atrial fibrillation is very common.
ਜੀ
ਤੇ ਇਸ country 'ਚ ਇੰਨਾ problem ਨਹੀਂ ਹੈਗਾ, but rheumatic heart disease, rheumatic fever,
ਜੀ
ਜਿਸੇ ਬੱਚਿਆਂ ਨੂੰ streptococcal throat infection ਹੁੰਦੀ ਹੈ ਤੇ
ਜੀ
ਫਿਰ ਅੱਗੇ ਜਾ ਕੇ ਇਹਨਾਂ ਨੂੰ valvular heart disease ਹੋਵੇ,
ਜੀ
ਉੱਥੇ again atrial fibrillation is very common.
ਜੀ
ਤੇ ਉਹਦਾ treatment again is best handled by specialists in valvular heart disease and congenital heart disease.
ਜੀ ਡਾਕਟਰ ਸਾਹਿਬ as being a full time doctor is there anything ਜਿਹੜਾ ਤੁਸੀਂ ਕਮਿਊਨਿਟੀ ਵਾਸਤੇ ਕੁਝ ਕਰ ਰਹੇ ਹੋ ਜੇ ਤੁਸੀਂ ਕਰ ਰਹੇ ਹੋ
ਸਾਡੇ
please ਸਾਡੇ viewers ਨੂੰ
programs
ਦੱਸੋ।
ਹੈਗੇ, ਇੱਕ program ਹੈਗਾ for community awareness of risk of dying suddenly,
ਜੀ
because ਅਗਰ 300 million people ਹੈਗੇ and half of million will die
ਜੀ
suddenly, who are these people, ਕਿਸ ਤਰ੍ਹਾਂ ਇਹਨਾਂ ਨੂੰ identify ਕਰਾ ਜਾਏ, patient new information in terms of awareness is one piece.
ਜੀ
The society, the awareness through programs through the church, mosque, synagogue, gurdwara can
जी
also be accomplished. The ude direction is ਅਸੀਂ automatic external defibrillator program ਚਾਲੂ ਕੀਤਾ ਹੈ, AED program, so that ਕੋਈ ਵੀ ਜਗ੍ਹਾ ਹੋਵੇ ਜਿੱਥੇ ਕਮਿਊਨਿਟੀ ਦੇ ਮੈਂਬਰਸ ਗੈਦਰ ਕਰਦੇ ਹਨ,
ਜੀ
ਜਿਸ ਤਰ੍ਹਾਂ 에ਅਰਪੋਰਟਸ ਵਿੱਚ ਤੁਸੀਂ AED ਦੇਖਦੇ ਹੋ, ਕਸੀਨੋ ਵਿੱਚ AED ਦੇਖਦੇ ਹੋ,
ਜੀ
ਉਸੇ ਤਰੀਕੇ ਨਾਲ ਅਸੀਂ not only knowledge but AED ਵੀ deliver ਕਰ ਰਹੇ ਹਨ in the
ਜੀ
community. Then ਅਸੀਂ a program ਇੱਥੇ Queens ਵਿੱਚ in a mosque, in a gurdwara,
ਜੀ
all the way up to Fishkill,
ਜੀ
ਦੇ ਗੁਰਦੁਆਰੇ 'ਚ ਅਸੀਂ ਇਸ ਤਰ੍ਹਾਂ ਦਾ ਪ੍ਰੋਗਰਾਮ ਕੀਤਾ ਹੈ.
ਜੀ Dr. Saab, I would like you to thank Power Media, our sponsors. Would you like to say a few words for them?
I'd like to thank Power Media. I'd like to thank our lovely host
Thank
for
you.
hosting me, for giving us an opportunity to talk about public health issues in the field of cardiology. I think this is a great public service that Power Media is doing for the community at large, and I think I really respect them for bringing health matters to you.
Viewers, ऐसी साढ़ा अज दा शो विद डॉक्टर रंजीत सूरी जेह्ड़े कार्डियोलॉजिस्ट सी. Viewers, सानू उम्मीद है कि तुहानू इस एपिसोड नाल बहुत फायदा होएगा एंड फॉर यू एंड फॉर योर लव्ड वंस. Viewers, ਅਸੀਂ ਮਿਲਾਂਗੇ ਤੁਹਾਨੂੰ ਅਗਲੇ ਹਫਤੇ 8 ਵਜੇ ਸ਼ਾਮ ਨੂੰ. ਵੇਖਣਾ ਮਤ ਭੁੱਲਿएगा only on TV 84.